Sorry, Kenneth Frank, den Jiji de Treju, one de Chukwa, Yente Tetrin Chip, go Antinki that we Taijagori, G COVID-19, I injured vaccines on Taikitsai. I den Jivan answer head I injured den scientists net in G engine Zigi and other den Jigia and answer Thai. Other junior attack engine Zigi and G6 where the attack no only gets of tragging. No only G short again, then G take then G Nako, okay, cause again. Then G one lay take again go horse again. No, quite yet check it, it's also again.
As Alaskans, we all have unique stories to share. We go on adventures, practice our healthy traditions, and spend time with the people we love. Our lives are filled with moments of joy, moments of pain, and everything in between. Every story matters. And at the Alaska Care Line, we're here to listen. Call or visit us today and tell your hard story.
Sometimes people appear fine, but we know they need help with domestic violence. Healthy relationships are important for our people and our communities. So it's important for all of us to learn how to support our friends, family, and community members. If someone you know needs assistance, resources are available to help Alaskans come together for the health of everyone.
Dr. Zinkam Kanamcha Nulichklik, Mutlhamak Danglunga Iarami, COVID Damak Naululuni, Dakan Winga, Ilako Rashungani, Aipako Radushungani, Nauluchinani. Winga Kapschuluni, Kakichiluni, Dakwam Nulicha Kapksaitluni. Una Daring Stak Darawuk, Kakishuting Kapschanun. Charlie kapksail ngornun. Tamarmak yuvriuti COVID tank saklinilut tawam winga nalu yachtok yuvrik saitlhukuni nang tkuchitlhomi. Nulicha toni inriwigmun yung tarwigmun itchmuchtlhot. Kaput ikayut mukapichtliniut. Nalunritachkak put. Yut tamarmang kapstigadut. Illait piungermang kapstiga nating apkuchiting huallu timamuktkun aran kalugutang klchtang chokluki huallu ukfiting pitkluki piumi nating. Chingurchiga taput kapstarluki chalilu changaksunnai taput huallu alakauksunnaunaki. Chingu mamtchi kaplkarptsnun takwam elpitsnun attaq Kwallu dusngap.
Ashwa naning kadada tlegi.
Aha, saning kadada tlech. Nentu.
Aha, sikun saning kadada tlegi. Taha dagainta.
Bayal dagasta a.
Gushu kada dananing kadada tlegi. Ka abanet lel tasa tahtoga.
Aha.
When Christian and I met in college, we connected over our culture and values. When we found out we were pregnant, we were excited to share traditions with our baby.
We knew I had to quit tobacco.
Quitting is hard. Staying quit is even harder. But I quit so I can share my traditions with my son. Why do you want to quit? Ask your provider about smoking cessation treatment or call the Alaska Tobacco Quit Line.
Jamai, huinga nukakalugo, amitlamakanan yupiugo, pamdakitlarmiu. Anaka, guigilagmiuk, ataka, gasauruk, Port Orchard, Washington, agmiuk. Huinga, kekwanaugo, thinkidaugo, hideaugo, drathnachigensaugo. Hi, my name is Valerie Davidson. My Yupik names are Nukhagalakan Amitlamakanan, and I have the honor and the privilege of being the president and CEO of the Alaska Native Tribal Health Consortium. My family is originally from Bethel. My mother's family is originally from Guigiluk. I was born and raised in Bethel and also upriver in Aniak. On my father's side, my father's family is Gasak, which means they're not Yupik, and they come from Port Orchard, Washington. Also, about 20 years ago, I was adopted by the Jackson family in Cake in Southeast Alaska, and they're both Tlingit and Haida, and I was given the Haida name Jathnach Higgins, which I'm told means noisy lady. I tell myself it's only because I have a really loud Native woman's laugh, the kind that you can hear all the way at the end of the village where the boardwalk meets the tundra, or all the way at the end of the beach. And today I'm speaking from Anchorage, the traditional homelands of the Dena'ina people. And we want to make sure that we honor their incredible stewardship of this land where we are so fortunate to work, learn, play, and live. And I want to welcome you to this year's annual meeting. Our annual meeting theme this year is in service to our communities. Together, we can achieve good health because we know that as Alaska Native people, much of our strength comes from the collective efforts of our families, our tribes, and our communities. Our agenda today includes a welcome by the ANTHC Chair, Bernice Kagilak, an invocation by Andy Jimmy, an introduction of the ANTHC Board of Directors. I'll provide a President CEO's update. We'll also hear overviews from the Alaska Native Medical Center, Community Health Services, Environmental Health and Engineering. We'll hear an update on the financials and an update from Alaska Pacific University. Following those presentations, we're going to be really excited to answer some of your questions, but I also want you to stay close to your computer or your phone to win some door prizes throughout today's meeting. But before we get started, we would love to see where you're all joining in from. So if you can take out your cell phone, I'll pretend I have one, and if you can text us to the number that you see on the screen, it's a pretty easy number to remember, 22333, so 2 2s and 3 3s, and add the phrase TOTTAK 216. So when you do that, you'll get a prompt to select a region that you're from. So again, if you text the number and the phrase on your screen now, you'll get a prompt to be able to see where folks are calling in from or participating from. And I can see some of our board members who are represented. I see the regions that you're from. I see North Slope region, the Arctic Slope Native Association region, our board chair, Bernice Kagilak. I see the Interior, Minto, Mr. Andy Jimmy, our vice chair. I also see some folks who I think might be family who are answering from the YK region, or the whole southwest region of Alaska. And I also see who looks like I have some family from Southeast in Cake. And so I want to welcome everyone to the meeting. Maybe we'll give it I see the numbers still moving a little bit. One of the great things about Alaska is that even though our state is big, we know each other, and our population is small, and it's one of the ways that Alaska is such an incredible place to live. Hoyana to all of you for joining. So I'm really pleased to welcome ANTHC's board chair, Bernice Kagilak, an enrolled tribal member of the native village of Nuiqsut. Madam Chair.
Arya, Koyanakpak, Pakalagipsi,
Kuya nakbarakip si ilatirosi, phone kun, naga kakisarak kun. Thank you. Greetings. My name is Bernice Avigawa Kakelak, Noksakamiu. And as your board chair of the Alaska Native Tribal Health Consortium, I welcome you. The COVID-19 pandemic has impacted all of us in every way that we do business and continues to do so. So we acknowledge those who continue to fight this illness. And remember those whom we have lost. And with that, we offer a moment of silence. Kuyanakpak. Please welcome Andrew Jimmy from Minto, our vice chair, and whom is representing the Tanana Chiefs Conference. He will be providing us with an invocation. Teku.
Heavenly Father, we pray that you will protect our people wherever they may be in Alaska, out of state. Lord, we just pray that you will guide us through our annual meeting, give us strength and wisdom to get better health care for our people. Lord, we pray for the people in the hospital for complete healing or wherever they may be. Lord, we just give you all the praise and the glory. Lord, we thank you for all the blessing that we received in the past. Lord, we just pray that you will be with all of us, our families. And we ask it all in Jesus' name. Amen.
Oyana, Andy, and Mr. Jimmy for that beautiful invocation. It's now my pleasure to introduce the ANTHC Board of Directors. You already met our chair, Bernice Kagilak. Vice Chair Andy Jimmy has represented the Tanana Chiefs Conference on the ANTHC board since 1999. Treasurer Robert Henrich represents Chugachmute and has served on the ANTHC board also since 1999. Sorry, 1989. Nope, sorry, 1999. I apologize. ANTHC Secretary Charlene Nollner represents the Copper River Native Association and has served on the ANTHC board since 2007. Representing the Aleutian Pribilof Islands Association, Mark Snigeroff has served on the ANTHC board since 2020. Representing Bristol Bay Area Health Corporation, Robert Clark has served on the ANTHC board since 2015. Representing the Kodiak Area Native Association, Loretta Nelson joined the ANTHC board this year. Representing Manilak Association, Lorena Walker has served on the ANTHC board since 2018. Representing the Metlakatla Indian community since 2019, Charles Clement. Representing the Norton Sound Health Corporation, Preston Rukuk has served on the ANTHC board since 2018. Representing South Central Foundation, April Kyle has served on the board since 2020. Representing the Southeast Alaska Regional Health Consortium, Kimberly Strong has served on the ANTHC board since 2019. Representing the unaffiliated tribes as a representative of Kanaitsi Indian Tribe, Diana Zerl joined the ANTHC board in 2020. Also representing the unaffiliated tribes, the traditional chief and chairman of the Chickaloon Native Village, Chief Gary Harrison, has served on the ANTHC board since 2008. And finally, representing the Yukon Kuskokwim Health Corporation, Walter Jim has served on the ANTHC board since 2017. And you know, here at ANTHC, we're such fans of self-governance that apparently, in my mind, some of the board members began doing self-governance at ANTHC before ANTHC existed. So I apologize for that error. But I do want to express on behalf of the organization and all of us really, our thanks and appreciation to the ANTHC Board of Directors for their incredible leadership and for their commitment to providing and improving the health and wellness of the people that we serve. So I want to remind folks again to please register if you haven't already done so at anthc.org/annual meeting, or you can hold your phone up to that QR code and registration will be open until 1:30. And registering also enters you for door prizes. And the other great thing about registration is that you can also submit a question. And we really appreciate your understanding that questions really need to be submitted through those links below or on the Zoom Q&A window in order to protect confidential health information. Our virtual annual meeting is also being streamed on the ANTHC YouTube channel, and it's being recorded. So you can watch it anytime on the ANTHC YouTube channel. And I would encourage you to tell your friends and your family so that if they want to learn more about ANTHC, they have the opportunity anytime again on ANTHC's YouTube channel. So today, we're going to hear updates about the Alaska Native Medical Center, Community Health Services, Environmental Health and Engineering. We'll also hear the 2021 Annual ANTHC Financial Report, and we'll also hear from the Alaska Pacific University. I also want to introduce our staff. Monique Martin just joined ANTHC. She actually rejoined ANTHC in a new role as Chief of Staff. Marissa Flannery has graciously agreed to be Special Advisor to the Office of the President. Dr. Bob Anders is the Alaska Native Medical Center Administrator. Bryce Akagi serves as Interim Chief Financial Officer. David Beveridge serves as Senior Director of Environmental Health and Engineering. Kirsten Kolb serves as Chief Administrative Officer. Rob Lynch serves as Vice President of Legal Affairs and General Counsel. Gerald Moses serves as Vice President of Intergovernmental Affairs. Allison Reed serves as Chief Ethics and Compliance Officer. And so you can see that information also on our website. So after the reports today, we're going to host a question and answer session. So we'll bring those folks back up live to be able to answer your questions. But first, if you will allow me to be able to make some comments as President and CEO about this last year. And I know I'm not telling you anything new when we recognize that we all faced incredible challenges over the last couple of years. And this last year for ANTHC has been particularly challenging. And I just wanted to extend a special appreciation to all of our friends and families who've reached out, and tribal organizations and tribes who have reached out to provide kind words of support to our employees and to our board when we needed it the most. And you know, the pandemic has really taken a toll on our mental and our physical health. And a lot of it really was unknown. We hadn't experienced a pandemic, well, at least not in my lifetime, of such epic proportions. I sound like a teenager when I say epic. I sound like my kids. Anyway, together with our families, communities, and tribes, we really listened and acted to the best of our ability. And as we learned more and more about the virus and the mutations that happened, the recommendations changed. It seems like they changed constantly. Were we wearing masks? Were we not wearing masks? But in partnership with tribes, local governments, state and federal agencies, our communities came together to minimize the spread of COVID-19. And it was a scary time, and we all pitched in with one goal: keeping our families and communities safe. And so we did really practical things. We masked up. we maintained social distance. And when it became available, we also deployed the COVID-19 vaccination throughout Alaska. And we prepared the best we could, pulling our resources together, whether it was personal protective equipment or PPE, access to testing equipment and necessities, including food and access to clean water. Tribes and the Alaska Tribal Health System came together to make sure that families and communities had what they needed. The last couple of years, we've heard over and over and over again in the news, on TV, on the radio, that we needed to wash our hands often, singing the ABC song long enough to be able to keep our families safe and to wash our hands constantly. But we also know how hard it was for families to hear that message when you don't have running water in your home. And so we really had to be creative. The environmental health and engineering team developed and installed the mini pass system to homes, making hand washing much easier. And we are so excited that the new infrastructure bill that was recently signed into law will help to get access to clean water and wastewater services in every Alaskan community. And for those who live in communities who've never had running water, we really join you in your thought, it's about time. And we look forward to lots of running water and many flushings of those puns to keep our children and our families and communities safe. So we also know, as I said before, the last 2 years has really taken a toll on our physical and mental health. And we heard you repeatedly identify the need for culturally responsible behavioral health services in your homes, because we were all in our homes during much of the pandemic. The ANTHC board championed this priority, and we are so proud to announce ANTHC's new behavioral health wellness clinic. And for now, we're offering telehealth services for adults. And there's just because you hear the word telehealth doesn't mean that there's any special equipment required. You can actually simply call 1-833-642-2492, or if you're here in town in Anchorage, you can call 907-729-2492. You can also visit our website at anthc.org/BHWC for Behavioral Health Wellness Clinic. You can see that information on the screen. We're also excited that we're going to begin providing services, behavioral health services, to adolescents in a few months. You know, our teams across the country, across our state, really throughout the country, pulled together to do what was needed during the pandemic. And I just wanted to provide a really big shout out to some staff here at ANTHC who really did incredible things. The purchasing and procurement staff, for example, who secured personal protective equipment, testing machines and supplies, and they also expedited shipping to our tribal health partners. The ANMC testing and laboratory teams who really worked around the clock to provide testing services and lab results so that our families could take steps to isolate, to quarantine, and stop the spread of the virus. The environmental services team who increased cleaning efforts to ensure a safe medical campus, getting rid of any trace of the virus. Employees who quickly shifted literally on a moment's notice to telework to maintain operations from home, which also provided appropriate distancing to support hospital and clinical operations. The frontline health professionals, oh my goodness, who did not have the choice to work from home and instead stood in the path of this virus on a daily basis. And we want to acknowledge both the clinical and emotional care that you provided to patients and their families. Often, you were there to hold a loved one's hand, whispering silent prayers and taking a moment to grieve when a loss happened. You also celebrated when the care you provided allowed a loved one to return home. And we also know that too often No matter what was happening around you, you still had to put on a brave face because others needed you now in that moment. And we know that that effort has taken a tremendous toll. And so, Koyana, to all of the ANTHC employees for bringing the light in the darkness by supporting our people, our communities, and each other. We appreciate you so much. And we also appreciate our board who stood behind the employees, making sure that they had what they needed at all times. To ensure the safety of the people that we serve here on campus and in your communities, ANTHC employees are now vaccinated for COVID-19, except for a few who have a medical exemption. So Koyana for ensuring that. And now we're going to hear from Dr. Bob Onders, administrator of the Alaska Native Medical Center, who will provide a live update on COVID-19 and what you can expect when you're visiting the Alaska Native Medical Center. Bob?
Thank you, President Davidson. And thank you, everyone, for joining us today. Like President Davidson noted, COVID-19 has really dominated our activities over the last year and a half. We've had to make significant changes multiple times, depending on the situation in the state, as well as the changes with the variants in the virus. Currently at ANMC, we have 14 active COVID-19 inpatients. We have an additional 13 patients who may no longer be in their infectious period, but still require hospital level care. That has varied over the last year and a half multiple times. The highest counts we had were over 40 active COVID-19 inpatients. As the situation has changed over time, we've had to change our protocols multiple times. Right now, because the case counts in the community are going down, the hospitalizations are going down, we're starting to loosen restrictions again, where appropriate. When you come onto the ANMC campus, whether you're here in Anchorage or traveling in from the regions, you will notice in housing, we have to have a limitation on the number of people, and we have one care partner or escort that's allowed there. And I know that can be challenging, but in order to ensure the safety, we have to do that. We have been able to open up the patient housing cafeteria. In the past, we had to do boxed meals, but as the safety protocols and the vaccination rates impacted the case spreads, we're able to provide better levels of services for that. We are doing screening at all the entries or in the clinics, and I appreciate your patience as we ask those screening questions. It's really necessary for our safety, as well as ensuring that everyone is masked, even on campus, whether you're vaccinated or unvaccinated. When you're on campus and indoors here, we do require masking as well. There are some procedures that you may come into town for that may need testing as well, particularly if you're having an operating room procedure. And that's a protocol, again, to ensure safety with the change with the Delta virus and the possibility of asymptomatically carrying that. So with all that, we continue to assess the external environment. As many of you are aware, there's new variants being found, and we may need to change again. We still know that vaccination is one of our best prevention and protection mechanisms, and we've seen that in the hospitalizations where vaccination has really protected many people. So I appreciate President Davidson. I appreciate everyone at ANMC in the last year and a half who've done incredible work, and thank you.
Koyana, Bob, and we appreciate you and your team at ANMC too. So Koyana for that update. So let's do our first prize drawings. Since I want to remind you that since prizes are considered taxable, there's no escaping the IRS. We will need some additional information from you before you can collect your prize. And prizes will be drawn, or were drawn electronically from those who registered at anthc.org/2021 annual meeting. So in appreciation to the folks who registered early, we have 5 prizes. And the first ANTHC jacket goes to Bev Johansson. Congratulations, Bev. The second ANTHC jacket goes to Don Davis. Congratulations, Don. We have a $100 utility assistance check, and that goes to Violet Apayalak. I'm sorry if I'm saying your last name incorrectly. We also have another $100 utility assistance check, and that goes to Francis Norman. We have Alaska Native artwork valued at $100, which goes to Teresa Lyons. Congratulations to all of the winners. I feel like I'm a bingo caller, making someone's day. So next, we're going to watch a video that will provide an overview of the Alaska Native Medical Center. And as many of you know, ANMC offers comprehensive medical services and acute specialty, primary, and behavioral health services to the 180,000 Alaska Native and American Indian people living here in Alaska. And ANMC is also home to one of our country's most unique healthcare environments, a place where the highest quality care and cutting edge technology complements the critical cultural and traditional services and patient experiences. Please welcome again Dr. Anders and the team at the Alaska Native Medical Center.
My name is Bob Anders. I'm the Alaska Native Medical Center Administrator. In my role with ANMC and ANTHC, I have the privilege of working with healthcare professionals and support services across ANMC, including primary care, behavioral health, specialty clinics, patient housing and travel, as well as patient experience. ANTHC co-manages the Alaska Native Medical Center with South Central Foundation. We also work extensively with our statewide tribal partners, as the mission of ANMC is to fulfill the mission of ANTHC and SCF by working together with the Native community to achieve wellness by providing the highest quality healthcare services for all Alaska Natives. This year, ANMC continued to address the challenges related to the COVID-19 pandemic. But we are also proud of the fact that our facility was able to provide ongoing healthcare services not related to the pandemic with limited disruption. ANMC staff had an especially challenging year with the increased volume of patients. Their resilience, hard work, and dedication to serving the patients that needed care is inspiring. ANMC was able to accomplish this continued high-quality care while also receiving our 3-year reaccreditation with Joint Commission, as well as instituting new technologies in surgery and working through elective surgery backlogs. Going forward, our priority will be to continue to increase and deliver high-quality healthcare services. In order to do that, we think the focus on the next year should be on our staff morale, retention, and recruitment. In order for us to provide the highest quality care, we need the best people here, and we want to be the employer of choice when people are looking for jobs in the healthcare environment. You'll now hear from ANMC staff sharing their work from this past year, including stories of the COVID-19 vaccine rollout across the Alaska Tribal Healthcare System, patient housing's incredible hospitality during the pandemic, the ANMC's lab's support of COVID-19 testing not only at the hospital, but across the state, as well as some exciting new surgical technology at ANMC.
The hardest part about the pandemic for patient housing has been the constant changes. The biggest one for guests, I think, was the cafeteria. We went from guests coming down to the cafeteria using their meal card as they wished and getting the meals that they liked, to 2 days later having to change to preset boxed meals for every single guest. And that process was a lot for both our food service team as well as our operations team, because not only did we have to change the way we're doing service, but we had to guess how many meals we were going to need each day. So we did have quite a bit of meal waste just from guests that weren't there during a meal period or guests that had opted to eat out that night. We operated with meal boxes for 1 year and 2 months, and now the cafeteria is opened partially with limited options so that guests can use their meal cards and come and pick their options again. We had to change operations to where we were not allowing visitors in patient housing, and we were also not allowing additional guests. So our housing rooms were restricted to patient and medically approved escorts. So our team went through a lot of changes. We had some that just didn't want to stay because of fear of the virus. We had some that were there. They adjusted to every single change. I feel like my team has become stronger as a result of it. I have a good team behind me.
ANMC purchased a surgical robot in March of 2021 this year to broaden the types of minimally invasive surgeries that we can do. What this means is shorter recovery times, meaning shorter time that they're in the hospital, shorter time before they get to go home, less pain. In addition to shorter recovery time, the robot allows us to filter out surgeon tremor and also allows us to access parts of the body that would be performed blindly or by feel only. The surgeon console has HD vision, 3D vision, and a significant magnification. So again, we're able to see the fine details of the surgical steps or anatomy, very precise surgery. ANMC's acquisition of the robot is just another example of how we're dedicated to providing the best care possible for our patients.
The laboratory started planning for COVID as early as December 2019, which is months before public health emergency was declared in the United States. And we were the first hospital laboratory in Alaska to go live with our COVID testing. By the end of April 2020, we had acquired 3 large high-capacity molecular analyzers for COVID testing, and a few months later, we acquired our 4th large high-capacity COVID analyzer. And for the first 6 months of the pandemic, we were probably the largest testing capacity hospital laboratory in the state of Alaska. Other facilities had not developed that same kind of testing capacity. And so we opened our doors to our tribal partners. They were welcome to send us as many COVID samples as they wanted, and we received thousands of them a day. And we were able to maintain a turnaround time of 48 to 72 hours for our tribal partners and for ourselves here at ANMC to meet the travel and procedural mandates that the state had put in place.
I'll never forget the day we received that first shipment of the COVID-19 vaccine. The ANMC pharmacy staff were ready. That's the word that comes to my mind. We had been preparing for months, and we were excited to be part of that historic moment. We also were viewing it as, at that time, hope for a potential end to this pandemic and how important that was to our people and to our staff, and that was really important to us. The COVID-19 vaccine, being an mRNA vaccine, presented unique challenges in that we had to be very careful with the handling of the vaccine itself in order to make sure that the integrity of the vaccine stayed intact during the handling, the storage, and the shipping process. The tribal health system was well equipped to handle the COVID-19 vaccine procurement and distribution. The framework had already been set and the relationships have been created. All of the little nuances of getting the vaccine out to our most remote villages and how we could do that in a timely fashion, safely, to ensure that everyone was able to receive the vaccine. And I have the utmost respect for our tribal health organizations who had to get the COVID-19 vaccine out into some of the most remote regions of our state. And they were delivering the vaccine with dog sleds, with snow machines, with small bush planes. And those unique challenges that we're presented with here in Alaska were nothing for them. And those folks are our true, real healthcare heroes.
Juliana, Bob, and the ANMC team. It was so good to see so many people from around the state. I want to give a shout out to our friends at the Yukon-Kuskokwim Health Corporation. I saw some folks in the video. I recognized the Bethel Airport. And I also wanted to give a shout out to all of those in tribal health who participated on calls on a daily basis, sometimes several times a day, to be able to adjust to be able to talk about what your community needs were. And those meetings still happen every week today. So, Koyana. I also wanted to let you know that at the end of all of the presentations today, we're going to take some questions. And again, to ask a question, simply type your question into the Q&A box on Zoom or by registering at anthc.org/annual meeting. And you can see that information at the bottom of your screen. Next up, a brief overview from the Division of Community Health Services, or CHS. And CHS monitors and improves the health of Alaska Native people by providing wellness, education, and prevention, and conducting research on important health issues. Staff monitor trends in death and illness and develop comprehensive regional and community-based solutions for priority health issues. CHS offers preventive health services and programs to elevate the health status of Alaska Native people and communities. Please welcome Kirsten Kolb, Chief Administrative Officer, and the team at CHS.
Hello, my name is Kirsten Kolb, and I'm ANTHC's Chief Administrative Officer. In my role, I work with departments across the consortium supporting the health priorities in partnership with our tribal health organizations. I also guide the work of the Community Health Services Division. Community Health Services work includes programs in wellness and prevention, the Alaska Native Epidemiology Center, research, behavioral health, and our training programs, community health aid training, dental health aid training, and behavioral health aid training. Prior to the pandemic, much of the work that happened in community health services happened in person, connecting with people from across our tribal health organizations. While limiting travel to rural communities has continued, I'm proud of the ways in which our ANTHC staff have been able to adapt the work they do to continue supporting our partners and in sharing important health information. We've continued to host educational opportunities. This year, we put on over 60 trainings for our staff and those in our tribal health organizations. Additionally, in our training facility, we had over 376 enrollments in our BHA training in FY21. We had 71 health aides enroll in our community health aid training, and this year we graduated 4 dental health aid therapists and started a new class of 6 students. In addition to that overview, we're pleased to share stories directly from community health staff about the opening of the Behavioral Health Wellness Center, about bringing together our training programs in our Education and Development Center, and the important work our staff does to provide training and first aid tools to save lives from opioid overdoses. I'm so proud of the work of our Community Health Services staff this last year in advancing our health priorities and connecting with communities across Alaska.
So the iknowmine.org website has a variety of resources in education and different pages with information related to substance misuse. We've been able to also send out about 600 Narcan kits across Alaska to both urban areas and then rural areas as well. Narcan is easy to use. It's not harmful to the end user, even if an opioid overdose isn't happening. Narcan is also easy to carry and can be added to any community response kit like a first aid kit. ANTHC uses a harm reduction approach in its services because we value the unique needs of Alaska Native people. You know, we see these community members not just as numbers, they're people. They're our aunties, they're our uncles, they're our cousins, our mothers, fathers, sisters, and brothers.
CHAPs are community health aides and practitioners that provide medical health care to the rural communities or villages throughout Alaska. And the Community Health Aid Program trains and oversees the CHAPs, the community health aides and practitioners. So last spring we moved into our new training space at the Education Development Center. We are integrated along with the other health aid disciplines, the behavioral health aid and dental health aid programs, Now we have ample space in the classroom, and we have 5 clinical exam rooms that reflect how a clinic exam room should look, to provide training to our students that come from across the state. And we sure love the space. It's really important to have in-person clinical and skills training to make sure they're getting the best learning experience.
ANTHC recognizes that behavioral health is as important as physical health. So the need for behavioral health service delivery out of ANTHC has been apparent for quite some time. There's been a lot of discussions about how we might be able to open up a clinic here. By providing telehealth services, we're able to provide care to people the day that they reach out to us for that care. It means access to care for rural Alaska. Being able to have qualified providers available to every region and community in Alaska is just, it's not possible. So telehealth has really opened up an opportunity for folks to receive care that they wouldn't be able to receive otherwise. We want people to be able to easily turn to a service when something is going on with their emotional health and be able to access that care without any questions, without wondering if they're experiencing enough distress for the help. We are here to provide for the everyday behavioral health needs of Alaska Native people living across the state. If we're not the right service for somebody, we're gonna try and help get that person connected to the care that's most appropriate for them. The Behavioral Health Wellness Clinic is part of the continuum of care that ANTHC provides to the people that we serve.
Oyana, Kirsten, and the CHS team. I was really thrilled to see the staff at CHS present the information. And one of the things that I saw in the video was something that wasn't mentioned, but I want to mention it because it's so good. For the Behavioral Health Wellness Clinic, the telehealth clinic where you can call, and that's thanks to our board making that a priority. They actually have healthy relationships group, and interestingly, all of the folks who signed up for that group are all men, and really a great opportunity to be able to meet people where they are. So I want to remind you that at the end of all of the presentations today, we're going to be taking questions. And to ask a question, simply type your question into the Q&A box on Zoom or by registering at the information on the site that you see at the bottom of your screen. But until then, let's do some more door prizes. And again, since prizes are considered taxable, we're going to need some additional information from you before you can collect your prize. So the first one, an ANTHC jacket, goes to Mary Kennick. Newton Mary. Another ANTHC jacket goes to John Kazevnikov. Congratulations, John. A $100 utility assistance check goes to Bessie Lee Weston. Congratulations, Bessie. Another $100 utility assistance check goes to Della Cini. Woohoo! Way to go, Ma. I'm related to her. I hope that doesn't disqualify her. Alaska Native artwork valued at $200 goes to Shala Kerrigan. I apologize if I've said your name incorrectly. And congratulations to all of the winners. And we're now ready to hear an update from David Beveridge, Senior Director of Environmental Health and Engineering, and his team. So working with tribal partners and communities to construct sanitation systems in homes and in entire communities prevents illness and promotes the health and well-being of Alaska Native people.
Hello, my name is David Beveridge. I'm the Senior Director of the Division of Environmental Health and Engineering, otherwise known as DHE. From even its earliest days, DHE has had a statewide role in preventative health and known mostly through our sanitation facilities construction program that provides access to safe drinking water and wastewater disposal. That's been a large focus. However, our team provides communities assistance with utility operations, energy reduction, and environmental health solutions. We also work with hospital and clinical facility managers and safety officers across the state, assisting them with surveys and inspections that will help their organizations maintain accreditation. This year, DHE was able to start or resume projects that were delayed from 2020's pandemic. Many in our team continued this year to work from home. However, we were able to get back out to communities again. Over 625 trips were made across all of our programs. Each trip required close coordination with the community and followed all local and regional protocols. DHE covers such a variety of work, it's hard to mention everything, but I want to take a minute to share a few of our accomplishments. This year, we developed a water operator training that was delivered virtually. This allowed operators to stay in their community rather than travel to some location that took them outside into a classroom setting. Being able to study within their own environment was a huge reason for a successful pass rate of the exams. We've also developed curriculums for additional trainings that will be implemented in 2022. We relaunched our electrical mechanical apprenticeship program. We hired 4 apprentices this last year, including 3 from rural Alaska. We resumed our engineering internship program, bringing on 5 Alaska Native ANTHC students, one of which graduated and is working with us this year. Our energy program completed energy audits, retrofits, remote monitoring installations, and technical assistance in over 45 communities across rural Alaska. The Alaska Tribal Conference on Environmental Management was another huge success this year. With over 370 participants, we were able to connect people across Alaska to discuss and learn about challenges that their communities are facing. And finally, 150 homes were provided a higher level of service through installed water and wastewater facilities this year. Next, you'll hear from 3 DHE employees that will share in more detail some of our successes. This includes the Mini Pass project that provide basic sanitation services in many unserved homes, a unique community partnership with our ARUC communities, and a construction project that eliminated a public health threat caused by sewage spilling into the environment in one small community. I'm proud to be part of a team that is so passionate in what they do and united in a purpose to create healthy homes and communities across rural Alaska.
ANTHC really does uniquely tie healthcare, prevention, and water and sanitation together and threads that so that communities are healthier. In the past year, our team was able to get out 132 Mini Pass units into homes that don't have water and sanitation. Mini Pass is basically a mini version of our Full Pass system, which stands for Portable Alternative Sanitation System. The in-home system for Mini Pass has a hand washing station that has 20 gallons of clean filtered water that is gravity fed to a sink. And the sink has a low flow faucet, so each time you wash your hands, you get clean water. The Mini Pass has a vented honey bucket that has a ventilation system that pulls not only the smell of human waste from the honey bucket out, but it also pulls moisture out. So it helps eliminate the smell so they aren't using harsh chemicals to mask that smell, and also provides the homeowner less waste to haul out. I would say my most favorite thing in the response from our customers is seeing the joy in their eyes, especially the elders and children, and really knowing that we've made a difference and improved their health.
ANTHC is absolutely more than just healthcare. We are also improving the lives of rural communities by providing preventative healthcare, such as implementing water and sewer systems in rural Alaska. So the Alaska Rural Utility Collaborative is a program where we work very closely with our member communities, and the point is for us to build trusting long-term relationships because we want our communities to build capacity and understand how to operate and maintain and budget for their water and sewer system. Oftentimes this education and knowledge is not shared with our communities, and so we found it very important that we start to help communities learn how to do so. In CHEVAC, we had worked together with the community on what is called a heat recovery project. A heat recovery is when the power plant generates electricity, but then there's excess heat that usually goes into the atmosphere. And so what we wanted to do is capture that heat and divert it to heat things within the water plant and be able to save money because diesel fuel in rural Alaska is extremely expensive. And so this past year in March, we have completed this project and we're working through checklist items now, but they are going to see a savings of 12,500 gallons of fuel, which translates to about $55,000 in diesel fuel a year. And so we're really, really excited that this project has been completed and that the community will get to see this savings. CHEVAC has been such an amazing community to partner with. They have always been extremely engaged. The operators have a lot of really creative and innovative ideas on how to improve some of the challenges. They value their water and sewer system. They value their customers. They value the partnership that we have together. They don't feel like they're alone. And it's not just with the AREC program, but it's also with the other AREC members. And so they build relationships with other communities within the programs, and they don't always just have to reach out to us. They can talk to each other and help resolve water and sewer.
ANTHC staff work with the communities to identify the need within the community for future projects. The community is involved at multiple milestones to ensure that the product that we're planning to deliver is meeting their standards and needs. The Cluckwan Sewer Lift Station project was to deliver 2 community sewer lift stations. In previous years, there was an identified need that the existing lift stations had exceeded their life cycle. And over the last winter specifically, they actually completely stopped working at some point. So the community's wastewater was actually dumping directly into the Chilkat River and overflowing wastewater in residential areas. People were walking through wastewater to get to their homes. In the time between April and September, we were able to completely rebuild one pump station and provide a new pump station so that the community had a operational sewer system for the first time in at least a year. Seeing the appreciation on community members' faces and bringing health infrastructure to their communities. And that's what we thrive off of at DHE, is completing projects and delivering to the communities.
Goyana David and the Environmental Health and Engineering team for the update. It was really wonderful to see Catalina, Francine, and Jared provide a description of their incredible services that are provided. So I just want to remind you again that we are going to answer questions that will be provided toward the end of our presentation today. And again, if you can type your question into the Q&A box on Zoom or by registering and submitting your questions to the link at the bottom of the screen, we'll add them to our queue of questions. But for now, we have even more door prizes to announce. And again, since prizes are considered taxable, we will need additional information from you before you can collect your prize. So the first one, a $250 utility assistance check, goes to Don Jackson. Woohoo! Another $250 utility assistance check goes to Amanda Hoffman. Congratulations, Amanda. A third $250 utility assistance check goes to Holly Nollner. Congratulations, Holly. Another $250 utility assistance check goes to Beverly Marino. Congratulations. And I think what might be the best prize of all in this entire meeting, a case of jarred smoked salmon, yummy, goes to Brenda Ambrose. I want to come snichtach. I want to come visit you. Congratulations to all of the winners. And so now to provide the FY21, the fiscal year 2021 financial report, we will hear from Bryce Akagi, Interim Chief Financial Officer. Bryce?
Hello, my name is Bryce Akagi. I am the Interim Chief Financial Officer for the Alaska Native Tribal Health Consortium. I would like to share with you the preliminary financial results for the fiscal year ended September 30th, 2021. The revenue of fiscal year 2021 totaled over $802 million. $379 million of this revenue was from the provision of healthcare services at the Alaska Native Medical Center. The payers include Medicare, Medicaid, and various commercial insurance companies. We received $206 million from the Indian Health Services Compact. In addition to our regular funding, we received funds from the CARES Act and the American Rescue Plan Act in order to combat the ongoing COVID-19 pandemic. $127 million of our funding relates to the development of water and sewer projects in rural Alaska, as well as community health and disease prevention programs, the Community Health Aid Program, and the Dental Health Aid Therapy Program. The remaining revenue relates to various activities, including contributions and donations received by the Healthy Alaska Native Foundation through the Ravens Ball and other programs, tuition for the Alaska Pacific University, rental income from the Alaska Native Resource Development, and investment income from our investment portfolios. The expenses of fiscal year 2021 totaled over $748 million. ANTHC's largest division is the Alaska Native Medical Center. Expenses for ANMC totaled over $380 million. These include expenses for the provision of healthcare services, such as physician, nurse, and other staff salaries, medical supplies, the cost of operating patient housing, patient travel, and our purchased and referred care program. The consortium's business support services expended $156 million in 2021. The services include internal support for ANTHC, such as administration, human resources, finance, information technology, and statewide support for the Cerner electronic health record. The Environmental Health and Engineering Division provides support for the development of water and sewer projects throughout the state, as well as the Alaska Rural Utility Collaborative. The division spent $107 million towards these services last year. ANTHC spent $34 million to address needs for testing, vaccination, and alternate care sites on the ANMC campus in order to respond to the ongoing COVID-19 pandemic. Despite the challenges of COVID-19 and the Delta variant surge experienced in the state, ANTHC experienced moderate growth in fiscal year 2021. I'd like to thank you for the opportunity to serve you this year and hope you have a safe and healthy holiday season.
Oyana Bryce for the FY21 financial report. We appreciate you so much. So reminder, you'll have the opportunity to ask questions after all of our presentations are done later in our meeting. And remember to ask a question in the Q&A box on Zoom or by registering at the link below. So in December of 2016, the Alaska Native Tribal Health Consortium and Alaska Pacific University entered into a strategic partnership. Joining us today is APU's interim president and provost, Dr. Hilton Halleck.
Good afternoon, everyone. My name is Hilton Halleck, and I serve as the interim president of Alaska Pacific University. I'm delighted to join you today to share some updates about APU and a little bit about the opportunities that are available through our strategic partnership with ANTHC and the Tribal Health System. As you all may know, APU is a small private independent institution. The final fall headcount this year was 555 students, which represents a 12.6% increase over last year and a 5% increase over fall 2019, the pre-COVID years. We have degree programs ranging from undergraduate certificates to a doctoral degree in counseling psychology. There is strong interest from students throughout Alaska, from Old Harbor to Ketchikan to Nome, and we enroll students from 34 states and different countries. Our main campus is in Anchorage, and we have a farm campus, the Kellogg campus, out in Palmer. Both are on the homelands of the Denne'ina people, and we thank and honor the Denne'ina for their incredible stewardship on the land on which we live and learn. In 2016, APU announced its intent to become a tribal university. This was a reaffirmation of our founding mission as articulated by Dr. Peter Gordon Gould in the 1950s. Since then, we've been recognized as an Alaska Native serving institution based primarily on the percentage of students who self-identify as Alaska Native or American Indian. We also revised our Articles of Incorporation and added new members to the board so that we qualify as a tribally controlled university. 3 years ago, we established an Elders Council with representatives from throughout the state. They continue to be active, advising programs and faculty, working on a curriculum project with CITC, helping coordinate events like our ANTHC at 50 series, and engaging with students in classes and other activities. Part of our transition to tribal university has been to take a look at our curriculum and pedagogies. Faculty have been working on developing new programs and courses, as well as integrating and centering Indigenous knowledge in the curriculum. Some examples of new courses include a class on traditional plants and medicines, a course called Indigenous Knowledge in the Sciences, professional development course with the Alaska Conservation Foundation and USGS based on Indigenous land stewardship. And we have many other courses that have integrated traditional knowledges. Faculty and staff have engaged in workshops on decolonizing education and cultural knowledges. The latest faculty development workshop, for example, was on restorative justice and Indigenous peacemaking. Making sure our campus is welcoming both for our students and as a gathering place for the larger community has also been important to us. And so despite COVID, we've been working on art on campus. Our galleries are active with shows by Indigenous artists. We found additional funding for a renovation of our Rural and Alaska Native Student Success Center, and we've been making other improvemements to our campus. I want to highlight some of the strategic milestones that we have reached over the last year. We have just wrapped up our FY21 financial audit, and it was another strong year for us. We netted positive in our operating and saw a significant increase in our net assets. Some of that comes from a strong investment performance and other assessment of our land value. We, over the last year and a half, we used some federal funding that we received for COVID expenses, as well as FEMA funding and our other insurance money to make repairs necessary from the 2018 earthquake. And we've also been able to accomplish some deferred maintenance related to COVID, including some adjustments to our ventilation systems. This summer, we moved to test-blind undergraduate admissions. We've been test optional for several years, but this past summer, we moved to test-blind admissions at the undergraduate level. This means that we do not consider standardized tests and admissions or financial aid at the undergraduate level. We're committed to providing access and equity in our admissions process, and we recognize that standardized test scores are not good predictors of success for our students. and the access to test preparation and to the tests themselves is sometimes a barrier to admissions. Some of our graduate programs are still require standardized test scores because of state regulations or accreditation requirements, but several have suspended those during the COVID pandemic. We're excited to launch 3 new programs this year. We're launching a practical nursing program that leads to an LPN certification in Bethel this winter. We have launched a community and place-based education bachelor's degree that pulls through to our K-8 teacher certification program. And we will be launching a Master of Fine Arts in Creative Writing next summer that will emphasize Indigenous and Northern artists starting in the summer. It's been a big year for us for community engagement. We have been running year-long ANTHC at 50 ceremonies and recognitions, including our Indigenous Peoples Day ceremony in partnership with ANTHC and a number of other community partners, and ceremonies that will recognize the ceremonial signing of ANTHC on our campus that happened on our campus in December of 1971. We've also launched the Navigating the New Arctic Community Office that will work with Arctic researchers from all over the world to connect them with Arctic communities in Alaska to address needs identified by those communities and promote authentic community engagement characterized by culturally appropriate research methods, co-production of knowledge, and data sovereignty for tribal groups. And I also want to highlight that we are wrapping up. We're in the final stages of our presidential search committee. I want to thank President Davidson for her leadership of APU during a particularly challenging time of the COVID pandemic. We miss her, but we recognize that she has been called to serve Alaska Natives and ANTHC in her new role, and we wish her the best in that role. When we made the commitment to become a tribal university and reaffirmed our founding mission, one of our key priorities was to meet some of the workforce needs of Alaska, and that includes the healthcare workforce. We have developed a number of new programs over the last 5 years. Those include an undergraduate certificate and an associate's degree in community health that aligns with the CHAP program, undergraduate certificate and associate's degree in health occupations, where we're working with the Alaska Primary Care Association to award credit for apprenticeship opportunities. We have the only environmental public health bachelor's degree in the state. We have launched a bachelor's degree in health sciences that prepare students for a number of tracks in careers in health sciences. We have longstanding programs in health services administration and healthcare management in our business programs. And we have launched 3 nursing programs over the last 5 years, the LPN, which will start in Bethel in the spring, and the associate's degree and an RN to BSN bachelor's degree in nursing. The nursing programs have really taken off. We will be also expanding offerings for the associate's degree in Utqiagvik starting next fall. We also provide professional development opportunities for the tribal health system through our Alaska Native Executive Leadership Program, the ANTHC LEAD program, and we also offer simulation training for a number of healthcare providers in our nursing sim labs. I want to highlight the opportunities that are available at APU through the Alaska Tribal Health System Scholarship. The APU Alaska Tribal Health System Scholarship is available to all employees or board members of any Alaska Tribal Health organization and their dependents. And this slide gives a link to the information that's on APU's website about those opportunities. Since 2017, we have had 187 unique recipients of the Alaska Tribal Health System Scholarship. That started from 31 in 2017-18 to 103 in 2020-21. So we've seen great increase in interest in that. There were 81 Alaska Native Tribal Health Consortium match scholarships that went with those Alaska Tribal Health System scholarships. We have awarded over $1.9 million in these scholarships since 2017, and we've seen, again, a great interest in those. And I think that helps to make our education affordable for our partners in the tribal health system. I want to thank you again for the opportunity to update you on APU and our work that we do with the tribal health systems. If you have any questions about the presentation or any of the programs at APU, feel free to contact me at the information on this last slide.
Juliana Hilton for that APU update and for your very kind words. And I just want to remind you all that, it's never too late to go back to school if you started, or to start and get your degree or certificate from APU. And there are some students who are incredible who finished that undergrad degree in 4 years. I was not one of those students. I took a little break, stepped out for a little bit, and I finished my undergrad in 6 degrees, and then later on went to graduate school. And one of the things we've heard from folks is that during the pandemic, you may have been working in a job where you thought, really admire those healthcare professionals, and maybe I'm interested in being a nurse. And I will tell you that if you apply to APU, we have incredible opportunities, and you are almost guaranteed a job. And so never too late to go back to school, never too late to start in the career that you've always wanted to be in. So, Koyana again to APU. So we're almost ready to answer your questions. And again, Koyana to those of you who've submitted a question during registration. And again, to ask a question, simply type your question into the Q&A box below on Zoom, or by registering on our website at the link below. But first, I think we have our last prizes, not quite, almost last prizes, but we do have prizes that are drawn electronically. Again, I did not pick the winners, but from those who registered for the meeting, and since those prizes are taxable, we will need additional information. And so the first prize, I think we have Alaska Native artwork valued at $300 goes to Janine Garcia. Congratulations, Janine. We also have a $500 utility assistance check, which goes to Carla Nyakpuk. Congratulations, Carla. We have another $500 utility assistance check that goes to Galina Mandrigan. Congratulations, Galina. An iPad goes to Raina Paul. Congratulations, Raina. 20,000 Alaska Airlines miles goes to Leona Lynn Matheson. Enjoy that trip, but remember to wear your mask when you travel. And congratulations to the winners. And we are now ready to do the questions and answers. And we're going to do our best to answer as many questions as we can during this time. And so we received a lot of questions, and similar questions may have been grouped together, just so we can be more efficient with our time. And to help answer questions, I will call upon Dr. Bob Anders, the ANMC administrator, Kirsten Kolb, the Chief Administrative Officer and Interim Director of Community Health Services, Kirsten Kolb, David Beveridge, Senior Director of Environmental Health and Engineering, Bryce Akagi, Interim CFO. And again, to ask a question, simply type your question into the Q&A box below, or by registering at the website for the annual meeting. So we're going to do our best to answer as many of your questions as we can today, but also there are some who submitted questions who the questions might have been really more personal questions or about patient questions. And for those, since you did register, we're going to be able to reach out to you after that, because we want to make sure that we protect your confidential health information or the confidential information of the person that you asked your question about. So you're going to be hearing directly from staff after this meeting regarding your question, just to protect patient confidentiality. So today's meeting is also for our tribal health partners and our tribes to ask questions, and tribal members to learn more about programs offered by ANTHC. And I just want to extend a big koyana to ANTHC staff who submitted questions. And so for those questions, for staff questions, we gathered the information and we'll answer your questions in an all staff update that we're drafting. But today, really, our meeting is about answering the questions and the concerns of tribes. And so we have the first question. How are ANTHC Board of Directors selected? Well, the ANTHC Board of Directors are elected really close to home, where each of you live. And our bylaws outline the 15-member Board of Directors. And in recognition of self-governance, tribes select or elect their representatives. And there are 13 seats from specific tribes or tribal health organizations. And the governing body for each tribe or tribal health organization appoints their representative. In addition, there are 2 unaffiliated seats that are filled by unaffiliated tribes. So for example, I hope she doesn't mind, our Chair Kagilak, serves on the ANTHC Board of Directors as the representative for Arctic Slope Native Association. And so in this example, the Arctic Slope Native Association sets the policy on who represents them as a part of self-governance. And so she serves as an at-large member of the ASNA board and also serves as the ASNA chairperson. But again, ASNA designates who their representative is going to be. As I mentioned before, 2 additional representatives on the board or board of directors are designated by the unaffiliated tribes. So for example, Chief Gary Harrison was recently re-elected by the unaffiliated tribes to serve another term on the ANTHC board at their meeting last month. So let's see, let's turn to some other questions. So we have a question: how did COVID-19 impact health services, and how did it impact the ANTHC operations? And how did COVID-19 impact ANTHC's strategic plans for the delivery of quality healthcare moving forward? And so to first answer that question, I'm going to ask Dr. Bob Anders to address the first part of that question.
So COVID-19, as we discussed earlier, really impacted all aspects of ANMC operations. We have a large workforce here in Anchorage, but they're also members of the community. So particularly prior to vaccination availability, we had many workers who were impacted either contracting COVID or requiring quarantine or isolation because of family members or exposures at home. The impacts have lessened now that we have 100% or nearly 100% vaccinated workforce, or at least everyone who is eligible to get it has received the COVID-19 vaccine. So those day-to-day impacts are less, but we still see that impact in operations as daycare centers may close, as schools may close and open, and that has impacted our workforce. Most significantly, we have had employees that may have required medical care or may have been impacted significantly with family members or others who have passed related to COVID, much like other communities have seen. And that morale standpoint, I think, has been the most significant impact. We have never been in a situation where we need to work as hard for as long as we have with this COVID pandemic, and that has impacted our staff and the healthcare workforce, not just at ANMC, but across the country as well. So thank you, Val.
Oyana, Bob. And as you can imagine, before I asked Bryce to come to the podium, we received so many questions regarding the impacts of COVID-19 on patient care, safety measures for patients and staff, and the organizational health of ANTHC. And the impacts, COVID-19 really impacts nearly every aspect of our personal lives, healthcare delivery, and our economy. And we are continually, constantly reviewing how to provide services while protecting patients, communities, and staff. And so now I would like to ask Bryce Akagi, our interim CFO, if he could also answer that question as well. Bryce?
Thanks, Val. There were significant impacts to the operations that varied by the different areas. So some of our areas had significant declines in patient volumes, such as our emergency department. For a long time, they were experiencing volumes as much as 25% below what they had before the pandemic started. And you balance that with other areas like the lab, which saw a huge increase in the need for testing. So the economics of healthcare certainly changed during the COVID-19 pandemic and affected the amount of revenue we could bring in from our third-party payers, such as Medicare, Medicaid, and other commercial insurance companies. Another area that was significantly impacted was our supply chain organization and the team at the Regional Supply Service Center. They had to work extra diligently and tirelessly to make sure that they could bring in the personal protective equipment, the masks, gloves, and gowns to keep our caregivers safe, not only here at ANMC, but also to be able to help supply all of the tribal health organizations throughout the state. So despite a lot of the challenges posed by COVID-19, ANTHC continues to be financially stable and able to continue to serve the needs of the Alaska Native people. Thank you.
Oyana, Bryce. So we also have a question on how is ANTHC or ANMC working to improve communication with tribal health organizations? And we received some questions from patients, including others from the Yukon-Kuskokwim Health Corporation, Norton Sound Health Corporation, and also the organized village of Cake on improving the coordination of care for those who travel to Anchorage for services and keeping your local tribal health organization up to date on the care you received and the follow-up you need. We know that we need to do better caring for those who need to travel to Anchorage for care. And from the moment we start to set up travel arrangements to patients arriving at the Anchorage airport, riding the shuttle, and arriving at patient housing. Members of the search, I want to give a big shout out to the search patient experience committee and the board who shared their concerns with us recently. And I said at that meeting, and I'll say it here, we really appreciate it when people tell us the truth about the experiences that they have here, because until we have the truth, we don't know where we are from an individual and patient perspective, and that information allows us to be able to do a better job of meeting your needs. We also recognize that we need to double down and improve our efforts to be able to we're going to keep up all of our efforts to do better and ensure a better experience for those who are traveling to Anchorage. And we appreciate your trust that you have in us. And we hope that as you're traveling to town, you also work with your regional tribal liaison who can provide a little bit more information. But before I turn it over to Dr. Bob Anders, I did want to mention that we have a new app. It's called Tinitun, Tinitun, and perhaps later we can put it up on our website. If you look for our website, you'll be able to find that information. And it's really a wayfinding app, which means how do you get from one place to another? And you can download it on your iPhone, or you can also download it on your Android phone. For those of you who are maybe a little bit more old school, who don't have those cool snappy gadgets, my mom always teases me if my iPhone is so smart, then how come it's being not so smart? We do have some kiosks available on campus that will help you, that also have the Danuten app located on it so that you can help to navigate from one place to another. And then the other thing I wanted to make sure that you knew is this week, we completed the purchase of the University Lake Spring Hill Suites so that we can ensure that we provide more rooms for patients who are traveling for medically necessary travel. And with that, I'll ask Dr. Bob Anders to provide a little bit more information on the question. Juliana, Bob.
Thank you, President Davidson. And thank you for those questions. Like President Davidson said, I think we hear you because we have heard from other groups, including Search's patient experience group, as well as the clinical directors on a statewide basis and the ANTHC board of directors, that care coordination and that communication that is connected to that is critical in us delivering a good patient experience and delivering good care. I've worked in tribal health systems since 2008 and previously worked for Kodiak Area Native Association. And even when I started, that care coordination was an issue. Now working at ANMC, I also see where the challenges are. We are focused on that, particularly it's one of our, in specialty clinics, one of our FY22 goals to improve that. In order for us to improve the care coordination, there are many pieces to it, including the travel management piece, the housing, the transportation, and actually getting in here and having one or multiple appointments coordinated. So it's going to take us some time as we take a comprehensive look at this, but I want to acknowledge that we're aware that this is an ongoing issue and that it will be a focus of our efforts in FY22 to streamline the process and ensure that communication goes back both to the patients and to the regional tribal health organizations, and that we ensure that that care is well coordinated. Thank you.
Brianna, Bob. So we received another question. Please provide information on the funding allocated to tribes through the infrastructure bill signed by the president, including water and sewer projects, local hire, and how projects will be selected. And we received a number of questions about the infrastructure bill that was recently passed by Congress and the funding allocated to tribes. And thanks to our friends out in Uzinki, in Pitkas Point and Macoriac. David, could you please provide some more information?
Yes, thank you, President Davidson. I was going to give a few updates on the infrastructure bill, particularly with respect to the Indian Health Service $3.5 billion for the sanitation program. That's going to be distributed over 5 years, $700 million a year. $3.5 billion represented the whole entire need that was in the database that is maintained by IHS. In Alaska, the need in Alaska is over half of that. We represent about $2 billion of that $3.5 billion need. And so we would expect to see a substantial amount of that funding coming to Alaska over the next 5 years. Two key pieces of that, the act are, one, that it had $2.2 billion that was set aside to be able to fund projects that exceeded cost caps. Cost caps were something that have prevented a lot of our communities that are high construction costs from being served because of the limitations by the Indian Health Service. But in order to be able to serve these communities with piped water and sewer for the first time, those cost caps had to be waived. And so again, $2.2 billion will be provided towards those projects of the $3.5 billion. Secondly, is that there's these funds are good until expended. Some of these projects take several years to complete. So we were very pleased to see that there was no end on the spending. What that will allow, though, is that we can provide service to these unserved communities and finally get running water into the homes. And so we were fortunate enough with the America Rescue Plan Act funding that came in to get ahead of that a little bit by doing some comprehensive engineering reports that we're going to be starting on. This funding will also be used for aged infrastructure. So a lot of communities have been piped for quite a while, and they have existing water and sewer systems that are corroded and leaking. We saw earlier in the video one small community that had wastewater leaking through the community. So projects like that are also on this list that could be funded. Of course, the benefits for this of the funding being provided by this bill or this act is that the public health benefits very high impact on the positive health outcomes, but there's also the economic impacts as well, both to the local community and to the regions. We, in carrying out our projects in DHE and at ANTHC, recognize the value of local labor on our projects. Some of the best projects that we do are the ones where we have the most local hire. So we intend to do that as much as possible. And where we're calling in contracts to perform the work, we'll be including language in those contracts that would encourage local hiring to the maximum extent possible. Currently, there wasn't much language about how projects on the list would be selected, and IHS is going through a tribal consultation process to determine what that will look like. So we'll know more about how the projects on that list will get selected, but we are planning to participate in that consultation process. Our staff in DHE grew last year in 2021. We expect to continue to grow in 2022 and expand certain departments like our contract delivery team that will be able to execute a lot of this work, working with the community. So we're looking really forward to this opportunity and working with the tribes and the regional organizations to carry out this work and developing the projects. So I thank you, and we do look forward to this once in a lifetime opportunity.
Guyana, David, but before you go, did you say $2.2 billion with a B billion for sanitation facilities?
$2.2 billion.
Wow, that's wonderful. So those of you who use a honey bucket, I know I had a honey bucket for many, many years as a child, know that honey buckets have nothing to do with honey. And it is so nice to know that that funding from Congress and from this federal administration will finally allow us to bring running water to all of our communities in Alaska. Guyana, David. So we also know that access to behavioral health services, preventive screenings, caring for elders, responding to the traumas of colonization, and culturally appropriate services are issues that many of us wanted to hear about, and we received a lot of questions. So Kirsten, can you please provide some information on some of these next questions? So one of those questions is on behavioral health services. Can you answer what services are currently being provided for our youth?
Thank you, Val. That's a great question. Earlier today, you did hear about the Behavioral Health Wellness Center that we started this year that we're so proud of. And we're really looking forward to beginning to serve adolescents in the coming months. And so that's one service that we'll be able to provide to youth. The other thing that we are doing is actively engaging our youth on social media. And so we have a really active presence on Mental Health Awareness Month, Suicide Prevention Awareness Month, where we really do a lot to engage youth around mental health issues. And there's one unique project I want to talk a little bit about, and that's a partnership that we have with the Lower Yukon School District, where we are supporting mental health training and consultation in the schools and using traditional teaching to do that. You know, we're always looking for ways to engage youth on the topic of mental health, and we'll continue to do that over the next year.
Guyana, Kirsten. And so also, are there current projects or future initiatives that are focused on elder health and supporting caregivers?
Yeah, elders provide the connections that to our families, our communities, our culture, our language, and you know they're so incredibly important. And it's really, you know, our elders deserve those special services when they need them. And so we do currently have an elders program that organizes events and connects to our elders who are in long-term care facilities, assisted living facilities. They go on visits and provide lunches. Now, that happened a lot more pre-COVID, but since the pandemic, we've actually gotten really creative in continuing to connect with our elders through even phone calls. We provide elder care kits. In fact, we put together hundreds of elder care kits and sent them across the state this last year. And right now we even have a holiday gift gathering for our elders that we'll be giving gifts to our elders who are in long-term care facilities across the state. So we just continue to look for ways to really connect with our elders and care for them because of the care that they have given us for so long.
Oyana, Kirsten, there was another question on how ANTHC is addressing physical and mental wellness through a holistic approach.
Thank you for that. I think when you think about ANTHC's vision that Alaska Native people are the healthiest people in the world, we recognize that health incorporates all of these aspects: physical, mental, emotional. There are so many components to health. And so we really have to tackle it from a number of different angles. Community Health Services does that well. We have a number of different programs that are all focused on providing educational resources, technical assistance, training, really working with our tribal health partners to look at all of these different aspects of health and approach health as a holistic thing, not just the physical, but all of the other components of health as well. Thank you.
Oyana, Kirsten, I just wanted to add, I'll personally answer one question that I know we heard about, which was, what steps can I take personally to make sure that I continue to be healthy? So I'm going to share one little tip. So we heard a lot about cancer prevention, and there are things that many cancers that are actually preventable. And I want to share a little tip that my mother shared with me when I was a young lady. And every year she would say, okay, I just want to remind you that your birthday is coming up. And one of the things you can give yourself an annual gift on your birthday is you can give yourself the gift of health. And so when your birthday is coming up, think about the health, the preventive health screenings that you might be eligible for. So, for example, is this the year in which I should have my women's screenings? Is this a year that I need to have a mammogram done? If you're a man, you think about the things that you need in terms of your prevention screening. So every year around your birthday, maybe ask yourself, are there health screenings that I should have? And I will confess that I am overdue for one of my screenings, which is a colonoscopy. And I know that's kind of an awkward topic because people are, it's not a real popular one, but Alaska Native people are at incredibly high risk for colonoscopies. And for the regular folks, their screening is actually recommended at age 50, but for Alaska Native people, the recommendation is to get your colonoscopy screening at age 40. And so I would really encourage you to do that. And Oyana to everyone who is taking all of those measures to do what you can to ensure that you live a long and productive life. We need you. We need you to be able to help us to make it through. I also wanted to extend Oyana or thank you to everyone who submitted a question. And I just want you to know that if we didn't get to your question today, we do have your contact information from the registration. So you'll definitely be hearing from us. So this concludes our question and answer period of the meeting, but the meeting's not quite over yet because we have the last 5 door prizes. And again, since prizes are considered taxable, we will need additional information from you before you can collect your prize. And so the prize, the Alaska Native artwork valued at $400 goes to Sandra Dementif. Congratulations, Sandra. A $500 utility assistance check goes to Roderick Carlson. Congratulations, Roderick. Another $500 utility assistance check goes to Michelle Wilson. Congratulations, Michelle. An iPad goes to, I'm going to do the drum roll. Paula Jones. Congratulations, Paula. And the winner of 40,000 Alaska Airlines miles goes to Patty Yaska. Congratulations. And I know those of you who travel will remember to wear your masks and to be safe. And I wanted to express our congratulations to all of the winners. We're so excited for you. So I want to extend our appreciation again, Koyana, for joining us today, and a special appreciation to the ANTHC Board of Directors, the leadership team, Alaska Pacific University, and most of all, Koyana, to all of you who are joining us today from home. ANTHC's mission is providing the highest quality health services in partnership with our people and the Alaska Tribal Health System. Achieving our mission really takes all of us in partnership with the people we serve to provide services that meet your health needs. And when we come together, we know that we can accomplish everything. I learned a long time ago that people really will do the most amazing things under the most impossible of conditions, as long as they have the right reasons. And children, families, and communities are always the right reasons. And so, Koyana Chaknak, for all that you do every day to support our children and our families and our communities. Koyana, for joining us today. Dwai, that's it.